Hello, everybody. I'm Suzanna de Baca. I'm the president of Business Publications Corporation and the publisher of DSM Magazine, and I want to welcome you to our Lifting the Veil series called Life Transformed. This is the final event in our series for 2021, and today we're going to be focused on caring for those who care for our kids. Last year, we launched this Lifting the Veil mental health series called Life Interrupted. It was so well received that we brought it back again this year, and we've been spending the entire year focusing on the mental health effects and of the multiple disruptions that happened in 2020 and 2021, and what you can do to support yourself or others. Today, as I mentioned, we're going to be focusing on those who provide care for our kids in many, many different ways. You're going to be hearing from some experts, providers who continue to have challenges as they care for our kids. They're going to be talking all about how we can support teachers, healthcare providers, mental health care providers. So if that describes you as a listener, we hope we have useful advice. If there's someone in your life in those professions, hopefully we'll also have useful advice about how you can support them as well as resources. Before we get started, just a couple of housekeeping items. You're all Zoom experts by now, but if your line drops off, just log right back on. We'll be here. If you want to post on social media, please use the hashtag DSMLTVproviders. We are going to encourage everybody to ask questions in the chat. If I see your questions, we might integrate those into the conversation along the way. Check your settings to make sure that you are actually chatting to everyone versus just the panel. But let's get started by chatting a question that you might have for today. What is something that you are especially concerned about regarding the mental health of those who care for our kids, such as teachers, providers, counselors, or parents? So just put those in the chat, and if I see those, we'll come back to those. I see burnout. Yes, absolutely. I think we're going to be talking about burnout, stress, anxiety, you name it. Before we get started, I would like to thank our sponsors who continue to make this program possible. Thank you to our supporting sponsor, Delta Dental, our supporting sponsor, Clive Behavioral Health, our sustaining sponsor, Employee and Family Resources, and our supporting sponsor, IMT Insurance. And of course, before we get started, I'd also like to thank the DSM team. This team works tirelessly to create and execute the Lifting the Veil publication, as well as this series, from the concepts to the stories, the design of the studying publication, to finding these experts who are joining us today, designing slides, working with sponsors. Just a lot of things go into making this publication and this series possible. I could not be more proud of our DSM and business publications team who make publications and programs like this possible. They are top notch, and this group really, really cares about our community. And as such, I would now like to introduce Christine Riccelli, who is the editor-in-chief of DSM Magazine, and she's going to tell you a little bit about this year's Lifting the Veil publication. Christine?
Welcome, everyone, and thank you so much for joining us today. I hope you'll all have the opportunity to explore this year's edition of Lifting the Veil. The magazine examines a range of mental health topics, including how art is helping children, especially refugees, deal with trauma, mental health in the workplace, personal journeys of healing, and daily doses of self-care that we can all do to stay mentally healthy. If you haven't seen the issue, you can read the online version at the address listed, or you can order a hard copy by calling the number on the screen there. And of course, if anyone ever has any ideas or thoughts of what we should cover in future issues, please don't hesitate to contact me. I think back to you now, Suzanna.
Excellent. So I know that you will want to read the magazine. I read the entire thing cover to cover the other night, even if I'd seen it all in copy prior. And it is truly stunning and gets to these very serious issues that we're here to explore today. And I was looking at the chat about some of the questions that folks had and things they're concerned about. I'll just read a couple of them here, though you can see rural issues. How can we maintain this level of stress? Burnout on childcare providers, which creates even more of a teacher shortage. How can school administrators support teachers? Educators are feeling unsupported. And so just some really, really great questions that we can integrate into our conversation today. So here's how the program is going to work. I am going to introduce the guest experts, and then we will share an audience question that we pre-recorded via video. And the experts are going to have a chance to answer that question and discuss some tools and techniques to help our viewers. We're going to have several questions and we'll repeat the same format. And if you have questions along the way, I'll keep my eye on the chat. So you'll see my eyes going over here, and I'll try to weave some of those in. Or we can save some of those for the end as well. So now I'm very pleased to introduce our guest experts. Our first guest expert is Dr. Angela Franklin. Dr. Franklin, who became Des Moines University's 15th president in the spring of 2011, has worked in higher education for more than 25 years. She is actively involved in the Des Moines community. She serves on countless boards, and she's really been a champion for diversity, equity, and inclusivity in our community as well. Her background is in psychology, and at DMU, she is responsible for training and supporting the next generation of providers. So welcome, Dr. Franklin.
Thank you. Good to be with you.
We're glad that you can be here. Next, we're joined by Dr. Brian Hall. Dr. Hall is a licensed mental health counselor, and he is the director of clinical services at Clive Behavioral Health, and is also an adjunct instructor at the Department of Psychology and Neuroscience at Drake University. Welcome, Dr. Hall. Thanks for being with us.
Good to be with you. Thank you.
Excellent. And our third expert is Cynthia Steidl Bishop, who's the Chief Executive Officer at Unity Point Eyerty Ball Community Mental Health. Cynthia has been with Eyerty Ball since 1993, when she was hired as a therapist following graduate school at the University of Iowa. So she's got the grassroots training. She has served on several boards throughout her career, and she currently serves on the Iowa Behavioral Health Association Board of Directors. So welcome, Cynthia.
Thank you. And thanks to the Business Record for hosting this forum today.
Wonderful. We're really pleased that you could all be with us here. So let's go ahead and get to our first question. We'll watch a video clip from an audience member who is Andrew Bauska, who's an Ankeny High School teacher. So let's hear from him.
As a high school teacher, I can tell you that educators are under even more stress and pressure during the pandemic than at any other time. Good teachers have left the profession, and even more will follow. My question is this: how can teachers care for their own mental health while caring for their kids?
It's a great question, and from somebody who's on the front lines experiencing that stress, I think we know that this is real. So Dr. Hall, I'm going to start with you and let you lead off with this question. How can teachers care for their own mental health as well as the mental health of their kids? Did we lose Dr. Hall? Well, I am not sure what happened to him. So hopefully we'll get everybody back. So Dr. Franklin, why don't I start this question with you?
Okay. Well, thank you. It was really shocking this morning as I woke and saw in the news another story about violence increasing in public schools in the city of Des Moines. And I can imagine teachers, are at a totally different place in terms of their fear and concerns raised at a heightened level of stress and anxiety, more so than they've ever experienced before. So the whole focus on why teachers choose teaching comes from a place of what their own personal desires are for how they want to give back and help mold the next generation. One bit of advice would be, how do you then begin to focus within and sort of recalibrate that vision and that purpose and that calling for why you chose teaching in the first place, to help sort of hit that reset button, because it's being challenged in a way that no one would have ever imagined before.
Absolutely. And, I was looking at some research around how teachers have been affected during the pandemic. And the Rand Corporation did some research, and it said the proportion of educators seriously worried about burnout rose from 1/4 to 57% in the pandemic. And so it's easy for that vision of why you're there to get lost when you're having a hard time keeping your head above water. Dr. Hall, I don't know how we lost you, but you're back. So what are
Yes.
your thoughts about that?
Well, thank you for the opportunity to address this question. I was saying to myself, it turned out, since I was disconnected, that this is a really personal question for me as well as professional. I've had the opportunity as a mental health therapist to talk with clients who are educators about their levels of burnout and frustration and feeling unsupported. And at the same time, I go home to a wife who's a second year first grade teacher who's experiencing some of her own challenges and working to support her, not so much as a clinician, of course, but as a husband. And one thing that occurs to me from both settings, clinically and personally at home, is our educators need to be heard at this time. Their feelings need to be validated. We need to be there to support them, whether we're doing so as a therapist, as a family member, or certainly for our school districts as administrators and coworkers. This is a time of strengthening community support for one another. That to me is one of the major takeaways of this pandemic in general. Although we've been isolated in our homes and separate from our communities, how can we work together? How can we come together in a community to provide support for one another? And I think that's how we begin to ease the burnout.
Mm-hmm. Well said. Cynthia, talk a little bit about how you're seeing that.
One of my staff recently told me that she had talked to a school counselor, and the school counselor has talked about the need is so high right now. And I think that we can speak to that not only in the school system, but as well as in behavioral health. And there's such a high need right now. And she was saying that the school counselor was saying that on her free time, she's going out into the community, into her students' homes to give them supplies and coats and helping, because there's such a high need, and she knows in her job what that need is. So in her free time, she's going out and she's helping others. So, it's hard to, where's the line in terms of when does work stop? And I think we have to think more about that, because, you can't pour from an empty bucket. And I think that we are all kind of experiencing that right now in this profession.
Absolutely. When I was doing some reading on this topic, the barriers, or I think the stressors cited during COVID. I mean, I think teachers always have a tough job, but longer work hours, trying to engage students remotely, pivoting from hybrid to remote to in-person, back and forth. And then, of course, these teachers are also struggling with fears that they or their loved ones might be getting sick. And I mean, so that really adds up to some significant trauma that I think we don't even necessarily understand. Each one of you have talked about support. So let's talk a little bit about what what does that support actually look like, either from an organization or from the community? Dr. Hall, since you talked about your family member being a teacher and you're dealing with teachers directly, what are things that you think are ways we can be supporting teachers? I think, did he freeze? We're having some, I think, some internet issues with Dr. Hall. Dr. Franklin, what are your thoughts about how we support teachers?
I think Dr. Hall started talking about listening and making sure teachers could be heard. And I would just sort of reiterate even more so validating those experiences. So I think what we can do most for our teachers who are struggling with all these added responsibilities is to make sure we validate those experiences as being real, that there are legitimate reasons for concern, legitimate areas of concern that may be out of their control, because as they juggle the issues within the students that they're there to help, they have their own personal challenges as well. So validating those as real so that they feel that someone cares and someone's listening and someone's there to help. And then figuring out how best to direct them to the places that could give them the help the most, which may be for them personally to sort of peel away and find their own support outside of the system, but get it from within, from the principals or superintendents, those administrators who are a part of the environment. But that teacher might want to also look to take care of some of those issues themselves personally by stepping out to find their own personal support, if not within family, within the professionals represented here on the screen today.
Absolutely. Those are great suggestions. And Dr. Hall, I think you're unfrozen now, right?
I hope so.
You looked just so intent that we didn't even realize that you were completely gone. But the question again is, in terms of teachers, what does that support look like, either from an organization or from the community?
I think it looks like having conversations about what the needs really are for each teacher. What are you needing in your classroom today? What are you needing outside of the classroom from your administrators, from your colleagues? How can we help you through whatever challenges you're experiencing? I think as a mental health professional, a key conversation is also, how can I help you as a therapist better help yourself through these challenges too, with engaging in consistent self-care practices? And I'll say right away, self-care is so easy to understand in theory. We need to take care of ourselves. Yes, we all intuitively get that, but in practice can be very challenging.
I think we lost him again. So, my feeling about the freezing on the internet is we just aren't going to stress out about it. And per our entire series today, we'll just roll with the punches. So Cynthia, you want to pick this thread up a little bit?
Absolutely. I'll speak more from the administrative side of things.
I find
what we as administrators, I think, really need to be aware of and conscious of what are we giving our therapists and our teachers? What additional work are we giving them? And I think about, well, as an administrator, we want to collect this many measures. We got one more measure we want to collect. And what is that doing to their workload? So they've already got all of these students or clients that they're working with that's already very stressful. And then we as administrators are saying, yeah, but there might be this one screening that might be really helpful if we just did that one more screening, and really think of the value of what we are asking. So if we want to put additional work on them, we need to be asking ourselves, is that really valuable? What are we going to do with that? And what is it going to do to our employees? And how they are going to get through the day, and is that really going to be helpful? Is it really going to be that helpful for us? So I think now more than ever, we really need to be aware of that.
Mhm.
And I would disagree with that because I would definitely agree because I think there's sometimes we've always done things a certain way and we've always needed those measures. We always needed that kind of data. So administrators are doing what administrators normally would do. But at this particular point in time, when we're noticing that people are stressed and that there are greater senses of anxiety about everything, perhaps the idea of perfection and striving for, the ways that we've just always done it is not necessary anymore. Maybe we can sort of reframe what's essential right now versus what's, okay to get us to the next place. And administrators sort of adjusting their expectations for our teachers as they're enduring all these many additional stressors might be a good place to start.
Mhm. Yeah, I've heard that phrase, don't let great get in the way of good. And maybe in the pandemic, we just have to make sure that we are getting things done, but not piling new things on. So Dr. Hall, we said no stress about dropping in and out. You're just like, it's like you're at a party and you're hopping off to get a drink. So
I
anyway,
promise that's not the case, but I appreciate your patience. I
no,
think we're in good shape now.
yeah, no stress about it. Anything else you want to add around supporting teachers, what that looks like?
I'm not sure how much of my last response you were able to hear, but I was encouraging self-care as well as supporting one another. Both
Mhm.
sides are so important. And as a clinician, having really important conversations with clients who are educators and otherwise about what stands in the way for you to engage in self-care. And oftentimes it's time. It's not enough time in the day to take care of myself as well as take care of my students and my family or other loved ones. But so important to have conversations about self-care does not equate self-indulgence. Self-care is something to do, hopefully without guilt, recognizing that the better you're taking care of yourself, the better that you're going to be there for the people who are depending on you.
Yeah.
Mhm.
I love to call that me time, and it's okay, to carve out the me time. We focus on everybody else all the time. Focus on me and what my needs might be at that particular moment. So me time is good.
So
Absolutely.
Dr. Franklin, at one of our other series on parenting, that came up a lot. And what the guest experts talked about there was kids pick up on things. Kids are smart. They know when their parents are stressed out, and that therefore compounds their own stress. So I guess I would probably say, I'm hearing from you, for educators, you can't care for others well and teach others well if you are not taking good care of yourself. Therefore, it's certainly not it's self-indulgent. It's actually critical for your success, and should be encouraged. Before we go to the next question, one of the questions in the chat I'd love to discuss. The person from ISEA says our educators are feeling unsupported by the community as demonstrated by questioning and attacks on what they're teaching, their professionalism, compensation, etc. So if a teacher's trying to do their work and then they're getting all this outside criticism, how would you encourage them to process that, ignore it, create boundaries, anything? And I'll just open it up to anyone who wants to jump in.
This came up for us the other night. My wife came home and she was feeling unsupported, and I heard her out and I encouraged her to journal about it, to start writing down the situation, but also her feelings and how that was affecting her. And in the process of doing so, I think she was really able to better understand what was most important about that situation, and from there, how she could communicate to her principal about her concerns and ask for more support and understanding.
I love that.
I also think about, we do get a lot of, we hear a lot maybe from the community, pressures maybe to get people in my profession, to get people in and access. And so there's all these stressors that are going on around us. But at the end of the day, it's really about what difference did I make? what difference did I make in that kid's life or in a client's life? And I think that's what our staff, and as leaders, we need to focus on, is the difference that they can make in just the few lives that they're touching in that day. And that's how they have to end their day, instead of thinking about all the noise that's going on around them.
And it's difficult sometimes to shield yourself from the noise. It gets louder and louder, and actually it's quite loud these days. But I think it's really important for teachers and those educators to remember that they will never be able to necessarily change the minds and the opinions of those who are wanting to attack and challenge, but stay centered in what's the main reason for being and the real purpose. And I love the point you made about what impact are you having on the lives of these children, and staying centered there and focus on doing the right thing for the right reason, and trying to sort of mute the noise from around, because that can easily penetrate. We just need to figure out how to put that shield up a little bit higher so that we don't let it impact what we've come there to do.
Excellent. Well, let's move to our second question. And this is actually being submitted by Andrew Allen from Youth and Shelter Services, or YSS, which is a mental health care nonprofit. So let's roll the video with Andrew.
At YSS, we're seeing unprecedented levels of trauma, resulting in significant needs from a mental health and substance use disorder standpoint for kids across the state. And I see our therapists working really hard to address the issues, but I sometimes worry that they're not taking care of themselves. What advice would you have for people in the helping profession, counselors, therapists, to really focus in on self-care?
Excellent. So this is a similar kind of question that we did with the teachers, but now we're focused on the people who are actually helping care for others' mental health. So Cynthia, I'll start this question off with you.
Sure. Andrew is absolutely right. I've been in this field for 28 years, and I don't think it's ever been so hard. It's a really hard profession to be in right now, because I think we're seeing more people than what we've ever seen. And so there's a pressure to see everyone, and we can't. And then also the complexity of clients that we're seeing is much harder than what it's ever been as well. There's more substance use issues that we continue to have to deal with. So the clients are, there's more of them, and they're a lot harder. So it's a lot more pressure for our staff. And what's happening is that there's a level of guilt of not being able to provide all the services that our clients need. And it's interesting. I had 3 different conversations yesterday, and it was the same general theme with each one of the staff people, is that level of guilt of, I've got all this to do, and I know they need help, and I can't help them. I don't have the capacity to help all of them. And I think that's what our therapists are really, therapists, and not just therapists, our community-based people, our healthcare providers throughout are all struggling with that. There's such a need, and we just can't help everyone.
Some of the research that I did, Cynthia, from the Mental Health Association, talked about 93% of healthcare workers say they're experiencing more stress, anxiety, frustration. 76% said they reported exhaustion and burnout, and 3/4 said that they're just overwhelmed. So, I mean, that's a tall order. And I think, as you're saying, then compound that with guilt on top of it, that's really, really challenging. So,
and our profession just wants to help everybody. Right. I mean, people who go into our profession just want to help. And when they don't feel like they can do that, then they're failing, or they're not being successful.
Right. And can be incredibly demoralizing. Dr. Franklin, obviously at DMU, you've got people in behavioral health, and you're training folks around it. What are your thoughts about this question?
Well, I disappeared there for a few minutes too, so I'm happy to be back with the group. Well, as a psychologist myself, so of course, having trained as a psychologist, I often reflect on what was important for me as a provider when I actually practiced as a clinical psychologist. But what was most important is to first know thyself, to really focus on what are the most important things, because those of us who go into the helping professions normally think about someone else before we think about ourselves. So remember, it's important to focus on what's important for the provider as well as you're going through the stressors, because we're typically there to hear everyone else's issues and concerns and help them navigate them, sometimes putting our own on the back burner. But it's really important to, one, remember why we're there, what the real purpose and calling is to be in the helping profession, but to then also remember that in order for us to be effective in that role, to be of service to someone else, we got to first take care of ourselves.
Absolutely. Dr. Hall, what are your thoughts here?
I keep thinking of the comment earlier, I think Cynthia said when we were talking about educators, and taking that step back, what did I accomplish today? Whose life did I touch? And we can ask ourselves as clinicians that same question and reframe our thinking about, well, who wasn't I able to get to, or who wasn't able to add to my caseload today? And I feel guilty about that. But at the same time, I am doing good work. I'm doing hard, important work and making a difference as best I can in the lives of my clients. So to have that conversation, if you will, in our own minds with our self-talk or with our colleagues, of course, is so important.
So you can enlighten me a little bit. I mean, obviously there's stigma around mental health or seeking mental health services for much of the community. People who are in the profession shouldn't have stigma around that. But is that a huge barrier for people who are actually therapists or counseling others, that they too need help? And if so, then how do you work with that? Anybody just jump on in.
Well, yeah. The therapists definitely, and mental health providers, they're human, and yes, it becomes very personal to them, and they need help and they need support just like everybody else. And I think as leaders, it's important for us to make sure that we are paying attention to them, and that we're able to see when they're walking down the hall, if they're looking tired, if they're coming in late, or if they're working a lot of hours, they're taking work home, or they're replying to emails on the weekends. I think it's our job to make sure that we are helping them to define those boundaries, and we are making sure that they are stopping work when it needs to stop, and then they are enjoying their families, not taking work home with them. But I think that's our responsibility to make sure that we're watching out for that.
Mm-hmm.
I'm not sure if it's the same for my colleagues on the panel here today, but I remember going through my training as a clinical psychologist and was strongly encouraged to actually engage in therapy myself, because the whole focus was, in order to be effective in it, you've got to be able to experience it for yourself and see the value and the gains from engaging with someone on the other side. So that was an encouragement for us as we were trained as psychologists, and it's something that continues to be an important focus for anyone in the helping profession to think about the impact that your own stressors and your own biases and your own issues may be having on the person that you're trying to be of service to.
Mm-hmm. Excellent. Dr. Hall, any thoughts there?
I'm thinking about the ethical considerations too, when you as a independent clinician, someone perhaps working in a private practice, are unable to accept a new patient because your caseload is full and there's only so many hours in the day, and hopefully you're not filling them all with patients, but to have referrals and resources that you can provide to people who are seeking your services, an explanation of why you're not able to meet those needs at this time, but also something to give them so that you're fulfilling that obligation and hopefully feeling, if not guilt-free, better that you've given them what you can and pointed them in a direction.
Mm-hmm. That's incredibly helpful, is even if you can't give them what you normally would, something to alleviate some of those feelings of helplessness around that. So one of the questions in the chat, or one of the comments, is that finding a therapist that understands you are also a helper is very important. You know the skills, but sometimes have difficulty using them. I think that's a really, really good point. Do any of you want to comment on that, or what's a best practice for being a helper who needs help? Mhm. Well, you laughed, Dr. Hall, so I'll call on you.
Yeah. Well, I was chuckling because I was thinking about, and also being a helper who's now on the other side of the couch, so to speak, and being willing to be in that role and not try to take control of the session, but let your therapist, guide it, and trusting in their clinical expertise. And of course, as we know as clinicians, sometimes we've just got to give it a try for maybe 2 or 3 sessions to see if we're feeling that sense of connection and that we're building trust and rapport in the therapeutic conversation. And if so, great, things are clicking, then you're off and running. But if after, like I say, 2 or 3 sessions in, I'm not saying just abandon that altogether. What I would suggest is have a conversation about that. Be upfront and honest with your therapist. Say, I'm not here necessarily to criticize. It might be constructive criticism, but I really want to let you know where I'm maybe feeling a sense of disconnect, and see what options we might have to try to address that.
Mhm.
I also think that we as therapists, I think we obviously recognize the value, but sometimes maybe don't recognize the need in our own lives. So I think we as leaders, again, when we start to see those signs of burnout and disengagement, maybe having a conversation with somebody, with your staff, and saying, you know what, you might want to go see somebody. Somebody that's totally outside and objective, and just having somebody to talk to, but really encouraging, like Dr. Franklin said, encouraging our staff to participate in the profession that we do, because it's helpful. And just to be able to talk to somebody is, as we all know, that's a really healthy thing to do. But sometimes especially in our profession, when we're so busy, we don't take time to take care of ourselves, and including maybe going to therapy when we need it.
Workforce is a real challenge, as we all know, and it's getting worse, not better. We need way more therapists available. Those relationships are so important. So I think the question about how can you find someone, especially in a rural community where you have to drive miles to find someone to provide that care, those are challenges that we need to continue to focus on. Universities need to be focused more on more training programs for individuals to provide this kind of care. But then there's the burnout. So those few that are here who are actually frontline now, as they burn out, there's not a pipeline to necessarily replace all of them. So we've compounded the problem by not having a strong workforce, because people want to be selective, and choose a person that's the best fit for them. Someone that really knows them and can provide the care, that they can really make that connection in those first few sessions. But we don't have enough. And that's another challenge for us, to make sure we continue to train more providers to be there, because as the burnout happens, and it's going to get worse as time goes on, how are we going to replace them? How are we going to replenish the pipeline of providers to come?
Well, that's actually a great segue to our next video and question, which is also around providers. So let's hear from Josefina Lopez from Proteus, who has a question.
Healthcare providers like those at Proteus have been under extreme pressure throughout the pandemic. How can providers or those in healthcare set healthy boundaries, care for themselves, and also mind their mental health?
So we talked a little bit about folks who are in the mental health profession, but this could be your family doctor, the oncologist, anything. So Dr. Franklin, let's start with you, since you've You've got a whole school full of these people.
Well, actually, given that I have educators there who are the teachers, I have providers, and then I also have a broader, focus and mission of training future healthcare providers. So all of these issues are really important to me, and to be a psychologist, leader of a health sciences university brings some interesting perspective, but also some interesting challenges, because on one respect, we want to try to do it all and figure it all out. And we've done quite a good job in providing our opportunities for our students to meet their own healthcare needs, through our counseling centers. We do a lot with our faculty, giving them opportunity to be heard and have this sense of belonging. But one thing I just want to lift up as a real opportunity is our NAMI provider training program. National Alliance on Mental Illness has a provider training program, and we adopted it. And we're right now the only medical school that's chosen to partner with NAMI for the very purpose, as we've been talking about, how do we make sure providers have a real appreciation, they have lessened the stigma about mental illness, but they also recognize and can advise and counsel any patient they may see, not just the therapist or the psychologist or the psychiatrist, but if you're a pediatrician or if you're a surgeon and you have someone who's challenged or in stress, you now have some tools through this program that's incorporated into our curriculum to be a better advocate for mental health and helping patients and the families of patients to get the right help that they need. So we proudly lift up the NAMI provider training program that's now incorporated into our curriculum at Des Moines University for students. A few other things I just like to mention. It's really important to make sure as we train providers and also be of care, give care to those that are in our care, that we stay focused on what's most important. We do a lot on campus about how to deal with stressors. Our students have this program called Stay Calm and Study On. We have even self-care bingo. So we incorporate a lot of tools within our campus dynamic, not just for students, but for anyone to be able to focus on meeting their own personal needs as they learn to be of service to others.
Mm-hmm. I like that. I think I might just copy that. So the self-care bingo, I'm writing that one down. So Dr. Hall, let's go to you now in terms of how can actual healthcare providers be taking good care of themselves and creating boundaries?
I apologize if I said this earlier, and it did actually come across before I got kicked out, but I was referencing a study of physicians who had said, yes, absolutely, self-care. Tell all of our patients and clients about that, promote and encourage. And then they were asked, do you do that yourself? And no, not nearly as much. So it's having really important conversations about what's getting in the way of that. Why are we not healing thyself, so to speak, when it comes to taking care of ourselves, not just for physicians, everyone we've been talking about today, mental health professionals, educators, and so forth, and having some specific conversations as well about when are we going to schedule this? How are we going to build habits and make this a part of our daily routines? Because a lot of times people are saying, I'm not doing proper self-care or enough self-care because I don't feel that I have the time for it. So we understand and validate that, but now let's really get down into the weeds about restructuring things, making the time for it, making it happen, hopefully daily.
Excellent. Cynthia, do you want to talk a little bit about how you're handling that?
I think we as leaders need to promote self-care. When we see there's such a need out there and people are coming into our facilities and wanting, we could just continue to talk about access, but how much do we talk about self-care to our employees? How much is that part of the conversation? And I think we need to be recognized when our staff maybe aren't doing that, or how can we encourage more of that? We talk about, oh my gosh, this person has such a great work ethic. But is that always the best thing? Because are they working at night? When I hear people talk about dreaming about work, I'm like, oh my gosh, I hope they're not doing, don't do that, because that means they're managing all of the stress from work in the middle of the night. And I just think that we have to be, as leaders, we have to be promoting self-care too. And we have to encourage them to, okay, when you get home, your family is the most important thing. Turn work off. You're not going to be able to do anything at home anyway. So stop it. Stop checking your phone. Stop looking at emails when you're sitting with your family, or hopefully not at the dinner table or when you're watching TV with the family. So I think we have to continue to make that part of our conversation at work.
Mhm.
I was just gonna say, I think a lot of it is putting aside ego and showing a little vulnerability. And I think it's something that we try to do as the pandemic happened and we were having more meetings on Zoom. It's okay to not be okay. And we are actually articulated that, not just with our students, but with our employees at my university, to really give people permission to be vulnerable. And it takes a big ego sometimes to kind of sort of come down off that high horse to say, I feel too. How many of you cried on a Zoom screen? I'll be the first to acknowledge the fact that sometimes
Today even.
right, yeah, to show some vulnerability that we feel too, we hurt too. And as providers, sometimes we forget that sometimes modeling that for our children and for our colleagues and for our patients to show that compassion so that people know that I feel too, and I can shed a tear because I experienced it the way you do, is okay. I think there's been this sense that, we need to be sort of stoic, and very formal and professional in our engagements with everyone, not just our patients, but everyone. And I think going through the pandemic has caused us all to rethink what professional demeanor should be or could be, because it may be a lot softer and come from a place of more compassion than we may have ever imagined before. And I think that's a good thing.
So compassion is a really interesting topic. I went to my own family doctor in my little town here over the Halloween, and they had a bulletin board that says, please be patient, we're working with a skeleton crew, haha, which was cute. But when I asked my doctor, how are you doing? What do you mean by skeleton crew? She said basically because of staffing issues, they were at 50%. So she was exhausted, and she said that patients are more stressed out than they've ever been before, and really being very demanding and not kind to providers. So there's the self-care, but then I think it gets back to what we were talking about, blocking out the noise. If you're a provider, you're seeing patients who are struggling and stressed, they're not being nice to you, and you're working on a half staff, then, what are some suggestions that you guys might have to say, okay, here's how you just don't lose your mind? What are a couple of coping mechanisms besides put down the phone? Any thoughts about that? Dr. Hall, let me ask you.
Certainly. I think it's so important to empathize. And the question that you asked your healthcare provider, Suzanna, is a great example. You're the patient. How are you doing? It's okay. Turn the tables a little bit, because this is human to human. So I'm interested in you. I want to know from you. And I don't know if it was communicated to you or not when you asked that question, but I can imagine that provided that provider or that clinical person with some degree of relief and certainly appreciation. So now to turn it back around for us working with people who are stressed out, frustrated, not always presenting in their most positive lights, to understand that, to still expect, respect, and to model that, but to also be aware of where these feelings are coming from. And easier said than done, I recognize, but to stay professional, to stay calm, to hear from people, what's really bothering you today? What can I do as a clinician of whatever level to help address your concerns? How can I be there for you, so that we're not just, oh, you're rude to me, so I'm done with you because you hurt my feelings. Yeah, that's the natural human reaction to have. So there's validity in that, but we also can't just leave it there. We need to work to do better than that for our patients, clients, students, and so forth.
That's excellent. Well, and I want to leave some time for some closing thoughts. So these have been wonderful responses to the questions that we had, so much good information. We also want to share a list of resources that you as our listeners can tap into. Over the course of the series, we've asked all of our speakers to give us some helpful area resources. So here's an entire list. You guys could take a screenshot, but in a follow-up email, you'll also get this same list of here's places that you can turn to, that you could give to the teachers, the healthcare providers, or the mental health care providers in your life to say if you do need someone to talk to or a place to go. We really have a rich array of resources in the Des Moines and Iowa area. So that's a great list of resources. So I want to give each one of our experts some time to think about some parting wisdom. I think we'll have just about a minute or two. And while you guys are thinking about how you'd like to send us off, I do want to let you guys know that we'd love to have you as subscribers to our publications. So I'd like to invite you to check out our stunning print publications, DSM and IA magazines. When you are a subscriber, you get the print magazine and also the free digital newsletters, plus special publications like Lifting the Veil and invitations to events like these that are educational, as well as to some more fun kind of parties. So the newsletters we'd love for you to think about were DSM Weekly, Weekend, and Wealth. We have a statewide newsletter. If you've got story ideas, you can send them in. And if you are interested in advertising and sponsoring, the information is also there. Christine showed us the new Lifting the Veil magazine, which is just stunning. The stories are fantastic. If you would like to get that, you can read it online by going to our website, but you can also call for a hard copy, and the information is right there, and we'd be happy to send one or have you stop by our office. We mentioned that this is the last in the 2021 series on Life Transform, which is focusing on kids and families. And we really just covered such a wealth of information. Next year, we're really excited that we're going to continue virtual events. We're going to do 2 since we're back in person a lot more now. And I'm excited to announce that our theme is going to be on recovery, a very hopeful theme to be exploring. So stay tuned for dates and additional information on 22. We'll be making sure that you have information so that you can tune in. So now let's go back to our experts. And if each of you just has about a minute of some advice that you'd like to leave our audience members with, that would be fantastic. And so I think I'll start with Dr. Hall. Any parting shots of wisdom or advice for the audience?
Thank you for this opportunity. I do want to take just a moment to let people know we're here for you at Clive Behavioral Health. When you're feeling overwhelmed, when someone that you care about, a loved one, is overwhelmed beyond a point that they feel that they're able to regulate on their own, we have services available for acute mental health care, an assessment center that's staffed around the clock by licensed clinicians. So please don't hesitate to come here to talk with someone, to learn about our services and services within the community. For parting wisdom, there's a sign over my right shoulder. It says kindness. And I have it posted in my office as a reminder to myself that we can always choose kindness. And I know firsthand, it's not always the easy choice to make, but it's a choice that can be made. And it's a choice that needs to be made so that we're doing everything we can to support one another, our colleagues, people that we're supervising, our patients and clients, our educators. Let's always be kind to one another and help each other through this incredibly difficult and stressful time as best we can.
Fantastic advice. Thank you. I feel that very, very personally. Dr. Franklin, what are the parting thoughts that you have for our audience?
Well, thank you. And it's been a pleasure to be a part of the conversation. I would say it's really important that everyone is very deliberate and take ownership of their own self-talk to make sure that they are very much aware, within how they are experiencing the stressors. First, know thyself, and then it's okay to not be okay, and show those vulnerabilities. And also, it's very much okay to ask for help.
Fantastic advice. And Cynthia, do you want to bring us home?
Sure. Again, thanks to the Business Record for hosting this forum. I love this conversation. I have three things. Remember the positives. Sometimes we go home and we only think about the negative things of the day, and just remember that there's probably more positives that happen during the day. Leave each day knowing that you did the best that you could do, and remember why, most importantly, in my opinion, is remember why you went into this profession in the first place. You are making a difference in people's lives, and that's what we always have to remember, is we are making a difference, and you touch somebody in a positive way that day. And I think that's how we always have to, when we get really super stressed, that's what we need to remember more than anything, is you are making a difference.
That's just beautiful advice. So incredibly true. I want to thank all of you for your words of wisdom. And of course, I want to thank our sponsors again for their support. Delta Dental, Clive Behavioral Health, which is a division of Mercy One, Employee and Family Resources, and IMT Insurance. Thank you for caring about mental health and helping to make this series possible. I can tell you that this series this year has I've been so pleased with the content, and for our team, it's been like a little free therapy sessions every other month. We really, really value and appreciate the reminder that it's okay to not be okay, that right now it's actually pretty normal to not feel good. You are not alone, and there are many, many resources, and there are many experts who are here for you, like the folks that we had on our panel today. So thank you to all of you for tuning in. Thank you for caring about the mental health of our community. Thank you for helping to lift the veil and to make it okay to address mental health issues. We look forward to seeing all of you in 2022, where we'll talk about recovery, and we wish you a very, very happy holiday season. So that concludes our program. Thank you everyone for being here. Bye-bye.